Blessings, you all. Blessings and more blessings. Welcome to Soulful Nutrition and Wellness, where evolution is essential for growth. My name is Michelle King, and it is an honor to be here with you again. Today, we will be discussing the topic of diagnoses and the importance of diagnoses, some of our apprehensions about being diagnosed, and what should we do about that. So again, let's go ahead and get started with diagnosis. First of all, though, real quick, I want to talk about D for dental exam. So the other day I went to have a dental exam and gained more insight. You know how you're told things, but it doesn't quite sink in until you get older, and then the pain starts setting in and things are going a little different when it comes to your dental exams. Well, I had someone that took care of my teeth the other day, and her passion was peridental health. So peridental health, meaning what is going on behind the scenes when it comes to your gum health and your bone health, the bone structure that holds your teeth in place. So she gave me an outstanding cleaning with no numbing, and I must say that I thought something was going wrong, because it's like, okay, don't I need to have some numbing? Is this a deep cleaning? But the bottom line, she taught me about pockets within the teeth and how food can, become enlarged there, and then you can't reach it, and then the bacteria, of course, bacteria grows, and then it goes from aerobic to anaerobic, and now is able to live without, the bacteria is able to live without oxygen. So now it's just eating away at your bone structure that holds your teeth in place. So D for dental. Make sure that you are having your dental checkups every 6 months, and as you get older, you may need to go in more often. So that was just a sidebar. We must push to keep our teeth health in order. Healthy teeth also helps to prevent cardiac issues. There's a connection with cardiac issues. So yes, and that's still all a part of diagnosis. But today, again, we're going to talk about diagnosis, and let's first hit on the definition of diagnosis. I at times do go and seek some of my information online, but I like to kind of ad lib as we discuss the topic at hand. So, diagnosis is the identification of a disease or condition by a healthcare provider through an evaluation of a person's symptoms, medical history, and the results of medical tests. So, this needs to take place, the whole process of having a diagnosis, in order to find out what type of treatment plan would be necessary for whatever the outcome is. So diagnosis and disease, you can kind of use the terms interchangeably, because the diagnosis is the dis-ease that would be taking place within. Ordering tests. So when it comes to diagnosis, depending on what your concern or complaint is, there are many different type of tests that can be ordered for you. So for one, they typically will do different laboratory blood draws. So you got your CMB, BMP, you have your complete blood counts. So CBC, you have thyroid panels, you have many different types of lab results, depending on what it is that we are looking for and what your complaints are. So the ordering of tests could also range from MRIs, CT scans, ultrasounds, and things of that nature, so that there can become, so that a conclusion can be obtained. Once you get your conclusions through your labs and your scans, then comes the diagnosis. So let's talk about diagnosis and what my experiences are, and also many others' experiences are, when it comes to being told that you have something going on, whether big or small. When it comes to diagnosis, when you have seen and heard tell of mistreatments in the healthcare settings, it also kind of makes you not trust going in. When you see certain commercials on television and others being diagnosed with different ailments that you just really wouldn't want to have yourself, it makes you apprehensive about going in to see what is going on. Recently, we saw via social media the mistreatment of two women of color, Black women. They were in labor and had gone to the emergency room to be diagnosed with active labor, and were mistreated and ignored and turned away. When those type of things are taking place in the healthcare setting and it is caught on camera for all the world to see, that will bring or can bring about fears and apprehensions and anger when it comes to seeking out the help that you may need for your own diagnoses. So with these two women, it was evident that the diagnosis was pregnancy, and they then now needed to be seen by a professional, medical professional, to diagnose them with active labor. And unfortunately, they were turned away and had to deliver their own babies. And thank God that, everything worked out okay. But then what about their psyche now? What about the next time they need some sort of medical care? So I could go on and on and on in regards to the mishaps and misdiagnosis, or just not being diagnosed at all until later, after things have gotten worse. That is a story of mine. You're just not heard. So advocating for yourself is extremely important. And it is very important if you're taking care of any of your loved ones, so that you can be heard. Because when it comes to diagnosis, no one knows more than you what you are experiencing in your own being. So after the diagnosis, before the diagnosis, you want to gather information through a battery of tests, labs, and then analyzing the data. Now, a lot of times, because of our current technological advances, we tend to get the results from laboratory tests and things of that nature via MyChart. MyChart is very beneficial, but it can also, send you into a tailspin of anxiety. So you're already anxious about going in because you're pre-diagnosing yourself usually. And sometimes you're right with what you have come up with. But anyhow, you're pre-diagnosing yourself. And then when lab results have come and you have gotten them through your MyChart before your physician has, so now that's bringing more anxiety on you. So it has its pros and it has its cons when it comes to being able to see your results before your physician. Once the labs have come in, now it's time to formulate what would be a diagnosis. What is the dis-ease? After the diagnosis, then comes a treatment plan. So if you've gone into your physician because you have frequent urination, or urination, burning upon urination, and you want to know what's going on. In your mind, it could be several different things depending on what you got going on in your life. So whether it's an STD, sexually transmitted disease, whether it is a urinary tract infection, so a UTI, we tend to want to, again, diagnose ourselves. But if this thing keeps festering, then you really wouldn't know until you went in and sought out some sort of professional help. So say, for instance, it's ends up being a urinary tract infection because your white blood cell count, is high, and the symptoms and the signs and symptoms that you spoke to the doctor may make the doctor feel as if, okay, this is what it is. But again, those laboratory results will give a definitive answer, or should. So then at that point, now you have to come up with what would be a treatment plan. So, placed on some antibiotics, I'm sure. And then you got your, natural means of drinking cranberry juice and some water, picking up on your oral intake of water to help clear your system of the bacterial infection. So diagnosis is important to be able to get to what is ailing you so that you can come up with a plan to be treated so that you can feel better. It is important, I would suggest, if you, say for instance, have gone to the emergency room for chest pains and an EKG has been performed, which is an electrocardiogram, to see what your wave patterns are looking like. And also perhaps they want to do an echocardiogram, which is having the opportunity to see a picture of the functions of the heart. And then you're sent to, referred to a cardiologist to get a closer look at what could be going on. Prior to getting to the cardiologist, there's all types of anxiety setting in. And believe me, I have been there. But the best thing to do is begin to take a look at, even before getting to the cardiologist, taking a look at what your questions would look like. We need to begin to know that it is okay to go in with questions, because this is your body and you must advocate for yourself in order to get the care that you really truly deserve. So one, go in with questions. We know that today we can Google anything. So have your boundaries on how much it is that you are looking up in regards to information, because you can begin to watch YouTube videos on cardiac issues and all sorts of things, and it's going to just bring about more anxiety. So have your boundaries, but yet advocate for yourself, advocate for your loved ones. That loved one that has dementia and can't really communicate to the physician in regards to what's going on, but you've seen that your loved one with dementia is having frequent urination, or when they go to urinate, there's not a lot coming out, then you must be the voice for that loved one. Then that's called advocating for yourself, and that is your right. But yes, going in and having your questions ready. One other thing too, white coat syndrome. Many of us suffer from white coat syndrome. So that's anxiety that sets up before you even go to your scheduled annual exam with your physician. White coat syndrome is a preconceived diagnosis that you may give yourself, or just the fact that you don't want to hear any what would be called bad news, or you don't want to be sick. Who wants to be not well? So white coat syndrome can show with increase in blood pressure and palpitations and all sorts of stuff. So just begin to be aware with who you are and what your needs are. And again, prior to any annual visits or, checkups that you are having to maintain, just go in with questions. I can't say that enough. It is okay to have your list ready. What else can I say about diagnosis? The main thing is take care of you year round. You see your physician if it's for an annual visit once a year, but you have the other 364 days out of that year to focus on caring for you, mind, body, spirit. The diagnosis is not the end of your story, meaning, and I know there are terminal illnesses. Such as cancer, but many things, the treatments have advanced even with cancer. I talk with so many patients and even co-workers that have had the diagnosis, loved ones that have had the diagnosis, and they're still here and they are thriving because there are a lot of technological advances. But do know the things that you implement year round for your well-being is extremely important. So whether it's your diet, whether it's your stress levels. I saw a video today that talked about trauma and how sickness and dis-ease can just reside in your being through energy and through things that you have gone through as a child that has carried all the way into adulthood. So when it comes to diagnosis, are we truly getting to the root cause of the different ailments and diseases that we are going through? Childhood adversities are something that we must begin to incorporate in our everyday existence, because that's something that is within, and no one can truly reach that place if you don't talk about it, if you don't pray about it, if you don't reach out for some sort of support. Then that thing or things can, those situations will reside within and further fester and can, come out as sickness and disease. I go there. The Bible calls it even like bloodline curses. So, know this. This is something else I wanted to share. Hippocrates. So Hippocrates is a Greek physician and philosopher. And I wanted to share two of the quotes that come from Hippocrates. One, it says here, if you are not your own doctor, then you are a fool. If you are not your own doctor, then you are a fool. So that does not mean that you do away with your primary care physician, you do away with any of the multidisciplinary team that may be in place because, you have a primary physician, but you've been diagnosed with cardiac issues. So now you have a cardiologist on board, and then that's, a lot to deal with. So now you have a psychologist on board or a psychiatrist on board. That doesn't mean that you just go and get rid and fire all of your healthcare professionals. No, that means that, you must begin to care for yourself, mind, body, spirit. The whole of you is your responsibility. We can't put this responsibility on our providers. They see you only a couple of times a year. I can't stress that enough as well. They see you a couple times a year, so it is your duty to care for you. Hippocrates also said, and this is one of my favorites, let food be thy medicine and medicine be thy food. Let food be your medicine and medicine be your food. It is not to say that medications don't have their place, but it is to say that food is used as medicine. So for an example, if you have diabetes and you feel that, your blood sugar is getting lower, you check your blood sugar and it's showing that you are getting low, and you choose to eat a half of an apple dipped in peanut butter. That's a natural means to help to bring the blood sugar back up to a place where you are feeling normal. That is allowing food to be your medicine. When you have a plate of vegetables and fruit and your protein, and it's a balanced plate, that is allowing food to be your medicine. So we as a people have to take our own lives into our own hands. We as a people must understand that it is okay to do so. And we must also reach for our loved ones, our neighbors, those that you pass by in the store. Be vigilant. We're all going through a lot. We all have a lot of different diagnoses. You can tell because when you go to Walmart, you see, people riding around in the electrical little devices that you can use to grocery shop. And they'll have their, their cane there in the basket, and it's like, just be mindful of others as well. So I hope that I have given you some insight when it comes to diagnosis. Just looking here to see if I have missed anything. The importance of diagnosis and knowing that, again, it is your right to know what your care plan is going to be, what you're being diagnosed with, what your care plan is going to be, and you being an active participant in making sure that you can reach some sort of balance again, homeostasis again, because remember, homeostasis is an inside thing. So just having balance within you, you're off when you've gotten a diagnosis. That means your homeostasis within is off. But that does not mean because you've gotten a diagnosis that you cannot return to balance. So I look forward to speaking on, my next video will be on discernment. And we'll chop it up again. And I just ask that God continues to bless you all. Until then, take care of you, soulful, nutrition, and wellness, mind, body, spirit, where evolution is essential for growth.